Thank you so much for staying with us. We are back again with another segment, and we're talking about first aid, how to manage bleeding and soft tissue injuries. That is what we're talking about this Tuesday. And once again, we have Brenda Murugi, a trainer with St. John's Ambulance Kenya. She's here with us to take us through everything that we need to know in regards to first aid when talking about bleeding and, of course, soft tissue injuries. Karibu tena, Brenda.
Thank you so much.
Good to have you.
Good to have you.
I know that this is very, very basic, but for the benefit of our viewer and, you know, for the basis of knowledge, let's just start with, you know, defining what first aid really is from your perspective.
Okay. Now, basically we define first aid as the first help or the initial help that is given to a casualty using available materials before handing over to a more qualified person. So we appreciate that when someone has been injured, before we even think about taking them to the hospital, the first help that we give them is what we refer to as first aid. And we're saying that whenever something has happened, most of the time you find that you do not have a first aid kit with you. So that is why we say that whenever you're giving first aid, you need to be creative and use available materials. So available materials can be things like, for example, if someone is bleeding, you can use a handkerchief, you can use a cotton t-shirt. That is what we mean by available materials. And then before handing over to a more qualified person. Yeah. So after you're done with a casualty, we need to take them to the hospital for further help.
So why is it important for an average person to know about first aid? And is it something mandatory that at least somebody should, you know, kama mimi niseme, I have to know 1 to 3 about first aid? Why is it important for an average person to know it?
First, most importantly, number one, we want to save a life. Okay. Usually we say that the action taken when someone has been injured before we even take them to hospital will determine if they survive or not. And then number two, we want to prevent the condition from becoming worse. Okay. For example, if you find someone is bleeding, the simple action of stopping the bleeding is going to prevent the condition from worsening. And then number three, we say we want to promote recovery. Okay. When someone, for example, has fainted and we elevate the legs and the casualty regains consciousness, then we have promoted recovery. So we refer to them as the 3 Ps. Those are the most important reasons on why we need to be able to learn first aid.
So you mentioned something about first aid kit. What should be in a first aid kit?
Okay. Now, let me start by saying that a first aid kit, the size of the first aid kit will depend on the number of people that it is serving. Okay. We have first aid kits that are small enough for a family, or the ones that you have in a car, or a family of 4. We have first aid kits that can serve up to about 100 people in an organization. So when we talk about the most basic things that should be in a first aid kit, number one, we talk about what we call dressings and bandages. Okay, so bandages are mainly used to immobilize limbs during fractures. Dressings are mainly used to stop bleeding. Of course, we need to have gloves because of the simple fact that you need to protect yourself when offering first aid to someone else. A pair of scissors will also come in handy for cutting clothes of a casualty, cutting a bandage if you need to use. Okay, we can also use things like, we can also have things like what we call a CPR mask. Now, a CPR mask is found in a first aid kit and it is used to give mouth to mouth to the casualty. So that is also very important to have in your kit. So we can say those are the most basic things. Now, the other things that we have will depend on the dangers that you face, either at home or in your workplace. But we can summarize and say that those are some of the most basic things that you need to have in your kit.
So we should be having a mask when giving mouth to mouth.
Yes, we should.
What about the people who just do it directly mouth to mouth? What happens when that happens, mouth to mouth, and not, you know, the use of this CPR mask?
Mouth to mouth puts you at a risk of cross-infection. Remember, there are some diseases, communicable diseases, that are usually spread through the air, through breathing in the airborne diseases, and also we talk about diseases that are spread through the saliva. Okay, so if it is a stranger that you have found on the road and they need CPR, we say you give what we call hands-only CPR, whereby you only do the chest compressions without the mouth-to-mouth. But if this is someone that you are well aware of their health history, their medical history, for example, a close family member, then probably you may risk, okay? But if it is a stranger, we say avoid it completely. Just give 120 chest compressions. Yes.
Interesting.
Yeah.
So today we're focusing on bleeding and soft tissue injuries. What do we mean by a soft tissue injury?
Okay. Now, soft tissue injuries are just the simple injuries that you get whenever you have been hit. Mainly, they occur from external force. Okay, so these are injuries that affect the tissue and the muscles. Probably they may not be so serious. Most of the time, they can be serious and lead to internal bleeding. So soft tissue injuries can lead to internal bleeding or the casualty developing what we usually refer to as a bruise. Yes.
Yes, last time we had a Toto. What are you working with today when we want to, to illustrate how to do, this first aid on a soft tissue injury step by step?
Okay. Now, when we talk about the soft tissue injuries, as I've said, what we are worried about is that the casualty may develop a bruise. Okay. Now, a bruise is usually a sign of internal bleeding. With internal bleeding, as a first aider, most of the time, the only thing that you can do is, number one, apply what we call a cold compress. Okay. Now, do
we have it here?
We do not have it here, but an example is something like deep heat.
Okay.
Okay, what you call the deep freeze. Now, the deep freeze is the one that we are used to seeing it in the shops. It is the blue one. Okay, if you are at home, then you can use something like ice. So most of the time, when a casualty has a soft tissue injury, what we like to do as in terms of first aid is to rub the injury, which is very wrong. Okay, so all you need to do is to take an ice pack and apply where your casualty has a soft tissue injury, and with no time, then the pain will go away and the swelling will reduce. But if it is a huge case of a bruising, whereby you can see that the bruise or the discoloration on your casualty is covering a large area, then in such a case, our casualty may need to seek medical assistance. Yes.
If we're looking at these soft tissue injuries, I'm looking at abrasions, lacerations, and of course contusions, that is bruises. But which of these is the most dangerous in terms of bleeding risk?
Now, when we talk about bleeding, let me start from there. When we talk about bleeding, we divide bleeding into two. We say you can have what we call internal bleeding or external bleeding. Now, internal bleeding is the one that occurs internally. And the blood may either have an outlet or not have an outlet. Okay? So if you find, for example, your casualty may have internal bleeding and they're bleeding through the nose or through the ears, that is a very serious sign of a skull fracture. Okay, but another sign of internal bleeding, as I have said, is the bruising. Now, the main risk that we have with internal bleeding is that our casualty may develop what we call circulatory shock. Okay, now circulatory shock is a condition whereby the vital body organs are not getting enough supply of blood and oxygen. Why? Because there's internal bleeding. So that one is why we say the casualty requires immediate medical help. Now, when we come to external bleeding, the bleeding that you can see, again, for that we have two types of bleeding. We have minor and major. Now, minor bleeding is the one that mostly occurs at home. You've been cut by a knife, you've been grazed by a wall, what you're calling the abrasion, okay? Laceration, you have a tear either from your cut has clawed you, the barbed wire fence, okay? Now, that one is minor bleeding. For that, we are not really worried about major bleeding. We are mainly worried about an infection. So for that, we say just clean the wound and apply a dressing. But now when it comes to major bleeding, that is what we refer to as life-threatening, whereby the bleeding is continuous, it is coming out in a large volume, and it is coming out in spurts. It is splashing. Okay? Now, that is why you need immediate first aid. If you delay, casualty will lose their life. Remember, we say that major bleeding is one of the most preventable deaths that we have. Okay, because the steps that we take are very basic, very important, but very basic. Yeah, so the simple thing of stopping the bleeding is going to
help
save a life.
So say somebody is breathing heavily, and at some point they lose so much blood and they become unconscious, but you're also trying to, do first aid on them. So do you start with, first of all, stopping the bleeding or trying to just bring them back to consciousness? What is the first thing to do? Stop the bleeding or try and bring them back?
Now, when you talk about bringing them back, because when we say that a casualty is unconscious, we have two types of unconscious casualty. We have an unconscious casualty who is breathing and an unconscious casualty who is not breathing. Okay, so the one who is not breathing is the one that we go ahead with CPR. Okay, but even as you're starting on your CPR,
the one who is not breathing is dead, Brenda.
No. We do not declare death as a first aider. Okay, that is the number one rule that we have. The only person who declares death is a doctor. Okay, so if you find someone who is not breathing, instead of writing them off, then we start what we call CPR, which are the chest compressions that we see people give. Okay, but if you find someone who is not bleeding and they are not breathing, it's as simple as wherever you find the bleeding, immediately tie something to apply pressure, okay, or get a bystander to come and apply pressure as you continue with your CPR. Because without the CPR, our casualty is going to die. But if we don't stop the bleeding, again, our casualty is going to bleed out. Yeah, so there we have to find a way of trying to do both of them at the same time. But as I've said, number one, stop the bleeding by applying pressure, find a piece of cloth, tie where the blood is coming out, and then move to where you need to do the CPR.
So step by step, is that the first thing that somebody needs to do, you know, when you're a first responder at a scene of accident? What is the step by step? Is it just applying pressure or what else needs to be done?
Okay. When we talk about giving first
and Brenda, I want to know what is in this bag.
In this bag, okay.
You're not opening it. My eyes are there.
Okay, now with me, I have carried bandages, okay, that are in our first aid kit, and I've also carried dressings, wound dressings. I wanted to show how we use a wound dressing, how we use a bandage, where we use them differently, and of course, I have with me a pair of gloves. Remember, we say that before you give a casualty first aid, isn't it? You need to protect yourself by using what you call the PPE. Okay, so we're going to look at also how to wear our gloves.
Yes. There's a way to wear gloves as well.
There's a way to wear gloves.
Take us through it.
Yes. So we start with or first we talk about.
Okay, tell us about the step-by-step bit first.
Dealing,
you know, I'm a responder at a scene of accident. What do I need to do first? Somebody would panic as the first thing, or maybe scream. But somebody who's trying to offer help, what is the first thing to do?
Okay. As a first aider or as a first responder, whenever you're responding to any incident, the first thing you need to do is to ascertain your own safety. Okay, so that means standing back and assessing the situation and asking yourself, realistically, am I in a position to help in this situation? If you find that you're panicking or you're not in a position to help, then it's as simple as taking your phone and calling for help. Because that is the most important bit that we forget. Calling for help is also part of offering first aid. Once you have ascertained that the scene is safe and you have now approached your casualty, we have what we call the priorities of life. Priorities of life are what we consider in a casualty and what we consider first. And we refer to them as the ABCs of life. Okay, so very quickly, if I can go through them.
Yes.
A stands for airway. Okay, so airway is what we call njia ya hewa. It starts from the nose, connects to the mouth, goes all the way to the lungs. What do we need to do with the airway of our casualty? We need to open the airway. And opening the airway is as simple as tilting their head backwards. So if you find someone who's lying on the ground, they are unconscious, then you need to tilt their head backwards. That way you have opened their airway. If someone is talking to you, then definitely their airway is open. So we move on to the B, which is breathing. We need to confirm that our casualty is breathing. And how do you do that? It's as simple as you're going to see the chest or the stomach of the casualty is rising and falling. Okay, so if you see that, then it means that your casualty is breathing. Again, if someone is talking to you, then they are definitely breathing. Okay, so let's move on to C. C stands for circulation. Now, circulation is how blood flows in our body. Okay, so what facilitates this? It is our heart. So basically we are asking, how can you feel for the heartbeat? Is our casualty's heart beating? And we use what we normally call the pulse points. The most common one that I think we all know is the one at the neck. Okay, so you put 2 fingers at the casualty's neck, find if you can hear the, we call it the do, do, do sound. That is the heartbeat. So once you have ascertained that your casualty's airway is open, your casualty is breathing, your casualty has a pulse or circulation, then we go ahead and now look for what we call the life-threatening injuries. Life-threatening injuries are the injuries that will kill your casualty very quickly. Okay, and top of the list, we always start with bleeding. So look for any bleeding on your casualty and then stop the bleeding. So again, if you come across a casualty at the scene of an accident, just go through your ABCs. Is their airway open? Is my casualty breathing? Does my casualty have a pulse? From there, I now move on to the bleeding. Where can I find the bleeding? Wherever you find the bleeding, it's as simple as applying pressure. Okay, and then call for help if help has not already been called. And remember, once you check the ABCs, you do not leave your casualty and move. After every 10 minutes, you need to keep on ascertaining that their airway is still open, that they are still breathing, and they still have a pulse. And then now that's where we say, if breathing disappears or the pulse disappears, be ready to start CPR.
And you're talking about the one that we all know, which is of course here on the neck, but there's one that we see being done on the hand. What is the difference between the one for the hand and for the neck?
Now the one for the hand, mainly we use it on a conscious casualty. Conscious casualty means you're talking to me, I'm talking to you, you're talking to me back. You're responsive, you're talking to me, you're conscious. So if I want to check for your pulse, I'll check it at the wrist. The one at the neck, mostly we check it for an unconscious casualty. Why? Because this is our strongest pulse and it is always the last one to disappear. Okay, so we say you can start from here, but if you don't find it here, because this one disappears very quickly, then quickly come to the neck. Yes, but that is the difference, conscious and unconscious.
Ah, interesting. Now, when you talk about after of course performing the ABCs of life, then one needs to move forward and stop the bleeding. But does applying pressure automatically stop that bleeding? Or how do we stop bleeding?
Very good. Now, when we're talking about major bleeding, there are 3 ways in which we can stop bleeding. Number 1, we talk about pressure or direct pressure. Number 2, we talk about what we call packing. Now, packing is used for wounds that leave a cavity. A good example is a gunshot wound. We need to pack the wound. And then number 3, we talk about a tourniquet. Now, a tourniquet is used when direct pressure is not working. So we have applied pressure where the blood is coming from. We are seeing that clearly the blood is not, has not stopped coming out, and our casualty seems to be getting worse. Then here now we need to move to apply a tourniquet. But always start with direct pressure. Yes, we do not always need to use a tourniquet. Sometimes direct pressure will work.
So how do we put on our gloves? You say there's a way to put on gloves. Siki Malamala to take us through that.
Very good. So before you put on your gloves, please make sure you clean your hands. Okay. So it's as simple as using soap and water. If you do not have soap and water, most of the time you'll find that in our first aid kits we have the sanitizers, the alcohol pads. Okay. So you can use that to clean your hands. Once you clean your hands, you're going to take the first pair, okay, the first glove. And as you can see, it is crumpled. So we like to open it up. Okay. Once you open it up, now this glove is in the shape of your hand. So you're first going to put in your thumb. Okay. Once you put in your thumb, stretch it out. Okay. Put in your fist, and then now straighten your fingers. Remember, I have washed my hands. That is why I am comfortable touching the glove on top. Okay. I take the second one again. I open it up. Okay. I first put in my thumb, stretch it out, put in the fist. Okay. And then very quickly you can straighten your fingers. So I've put on my gloves in a very short time. Na hazijararuka. Okay, because remember zikiraruka, then again you're exposing yourself to the cross infection. Yes.
So, you know, I see you have short nails, and I've seen this a lot with, you know, people who are giving first aid and first responders. Is that a requirement for you to have short nails?
It is not a requirement for you to have short nails, but we say at least if you have nails, let them be reasonably long, okay, to avoid the puncturing of the gloves and also injuring your casualty as you're giving your first aid. Yes.
So what happens when you say you don't have these gloves or you don't have any sterile clothes, but you still want to, you know, give help to, you know, whoever is hurt in that accident scene?
Okay. If you don't have a pair of gloves, then you can improvise. You can try and get nylon papers. I know you're going to say they were banned. That's where you're going. But we have things like bread. Okay, bread comes packaged in nylon. Okay,
Yeah.
you have things like sugar, they come packaged in nylon. So just use anything that you can find that is nylon, okay, to make sure that you're protecting your hands. But if you completely cannot find, again, I insist, your safety comes first. So if you find that you cannot help, it's as simple as taking your phone, okay, and calling for an ambulance. But over and above that, as a responsible trained first aider, it is as simple as making sure that anytime you're packing your bag, you're packing a pair of gloves, okay, so that in case you come across anyone who has been injured, it's as simple as taking your gloves from your bag, putting them on, giving the assistance that you can give as you're waiting for the ambulance to arrive. Yes.
So what you're trying to say is that it's nice for at least every living human being to have a first aid kit with them.
Yes. Yes, it is nice, it is responsible, it is recommended, okay, because with a first aid kit you can do a lot before you get your casualty to hospital.
It also helps one to protect themselves, right? So let's talk about the venous. We see the arterial, the capillary bleeding. Why is it important for somebody to know, you know, where they're situated, how they look like, what they look like, and how do we identify them?
Very good. Now we talk about there are three types of bleeding, okay? We talk about capillary bleeding, we talk about venous bleeding, and arterial bleeding. So capillary bleeding, this is bleeding that is coming from the capillaries. Capillaries are very thin blood vessels that we have. Most of the time, the most common place you find them situated are at, for example, around the nose. Okay. Venous, again, this is bleeding that's coming from the vein. And then arterial, this is bleeding that is coming from the artery. Why do you need to differentiate them? Because bleeding from the capillaries and the veins is what we equate to minor bleeding. Bleeding from the arteries is what we equate to major bleeding. So I need to identify, is my casualty having minor bleeding or major bleeding? Because if it is minor bleeding, then I need to be focusing on preventing cross-infection. That is why we talk about cleaning the wound. If it is major bleeding, I need to be focusing on applying pressure. There we do not clean at all. Okay, so how will you differentiate them? Number one, if the casualty is bleeding from the capillary or from the veins, the blood is going to be dark red. Dark red, I can equate it to liver.
Okay.
Okay, so you see the color of liver? So when you see the color of blood coming out like that, that is dark red blood. So it is coming from the veins and capillaries because it is not oxygenated. But when you talk about major bleeding, which is coming from the arteries, then the blood is going to be bright red, okay, or what we call crimson red. And then it is going to coming out in spurts. It is going to be shooting. The one for minor bleeding, the blood is just oozing. Yeah.
So how does, you know, the treatment approach differ from these three? If you're talking about the venous bleeding, capillary, arterial, how does treatment approach differ?
Now, again, as I've said, treatment approach will differ because here we have two different priorities. In venous and capillary bleeding, our priority is to prevent an infection. And then in arterial bleeding, our priority is to prevent the casualty from bleeding out, which is by applying pressure. Okay, so those are the two priorities that we're talking about. So in minor bleeding, focus on keeping the wound clean, okay? Focus on covering the wound to prevent any germs from getting into the wound. When you talk about major bleeding, we are saying focus on applying pressure, stop the bleeding. Whatever you need to use, here we are not worried, okay, about what you need to use. Use whatever you have, as long as you make sure that you're applying pressure where the blood is coming from.
So you have, however much it hurts, you just have to press on. Hapo tu kwenye kumekatika.
Hapo tu kwenye kumekatika, it is going to be very painful. Your casualty is going to be in discomfort, okay? But you need to explain to them that without this, they will probably lose their life. Yes.
So you mentioned something about the tourniquet. What are the dangers of tourniquet?
Okay. Now, a tourniquet, if applied wrongly, okay, can lead to, number one, you will not really have stopped the bleeding. And number two, it will lead to further damage. Okay. So the dangers of a tourniquet, it hurts. A tourniquet really hurts. So we say, please do not use it unless it is completely necessary. Number two, use of a tourniquet can lead to amputation of the arm. Because remember how a tourniquet works is, we are trying to completely cut off the supply of blood to that arm. Okay. So if we do that long enough, then remember that our casualty could lose their arm. But here we are talking about what is our priority. Our priority is we need to save a life at the expense of the limb. Yes.
So how would you explain what a tourniquet is to somebody, you know, I'm a skier for the very first time? That should have been the first question before I asked the dangers of tourniquet.
So as I said, a tourniquet basically is what we say kufungia damu.
And what does it look like?
And what does it look like? We have different tourniquets that we use that usually come in a first aid kit. Okay, but tourniquet, the most common one that I can explain is the one that we see when we go to the doctor and they're trying to remove blood from your veins, when they're trying to extract blood. There's that band that they usually tie so that the veins can pop out. That is exactly what we mean by a tourniquet. Okay, so the same way you're seeing it is being tied so tightly that your veins are popping out. So we are going to tie it so tight that we are completely cutting off the supply of blood to the rest of the limb. Yes, but over and above using a tourniquet from the first aid kit, then we also have what we call homemade tourniquets. Okay. Now, homemade tourniquets, although they are not recommended, but if you do not have one from the first aid kit, then you can use a homemade one.
Perfectly said. Now you know everybody has been to hospital, and of course, all of us have had that tied on us.
Yes.
That is a very perfect explanation of a tourniquet. But is there a time frame in which bleeding should be stopped, you know, to ensure that it's not getting fatal?
The time frame will mainly depend on where the bleeding is coming from. Because we say there, for example, if it is a gut wound or something like the liver, okay, there we are talking about 10 to 20 minutes. We need to have stopped the bleeding or else our casualty will have bled out. If it is bleeding from the limb, from the arm, then you're talking about probably within 30 to 40 minutes. We need to have found a way of stopping the bleeding, because we're saying if we do not do this, then our casualty is going to go into what we call circulatory shock. Okay, and with circulatory shock, the danger is we're saying that when our vital body organs are deprived of blood and oxygen, they start shutting down. Yes.
So under what circumstances should one not attempt to move a bleeding casualty?
Unless the casualty is in immediate danger, please do not move them around. Okay, that is the main mistake that we make. Okay, whenever we have a casualty who is bleeding out, we keep on moving them, and that moving aggravates the bleeding. So unless there is immediate danger, if you can, leave the casualty where they are, maintain or work on applying pressure and covering the wound, and let it be that the only time we're moving this casualty is when we are taking them to hospital. Okay, but not moving them from one scene to the next to the next.
I hear about it being so critical when somebody has a spinal cord injury, say broken bones or even head trauma. So what's the worst that could happen when somebody maybe with a head trauma or a spinal injury is moved from one place to another?
When we talk about spinal injury, we say when you find a casualty with a spinal injury, your main aim is usually one, to make sure that the head, the neck, and the back are aligned. Okay, so the danger that comes in when we start moving our casualty is that we are misaligning these three things: the head, the neck, and the back. So when we misalign, the casualty may suffer now permanent damage from the spinal injury. Because we usually say, even if your casualty has a spinal injury, does not mean that they are completely condemned to using a wheelchair. How we handle them when they're transporting them from the scene of the accident to the hospital will determine the extent. Are they going to be able to come back from it, or is it going to be something that is permanent? Okay. The same thing with a head injury, because most of the time, head injury, spinal injury, they go hand in hand. So if you find a casualty with a head injury, we say just assume and treat them as if they have a spinal injury. So avoid moving them, seek for help, and then find a way of transporting them to hospital in a safe manner.
So how can a lay person recognize that this one has, say, a spinal injury or that head injury?
Head injury. Okay. Now, let's start with a casualty who is unconscious. Okay. So the casualty is not talking, is not moving, and they are not responsive to your commands. So if you want to confirm that they have a head injury, if we start from the eyes, okay, we're going to open the eyes at the same time, and we're looking at what we call the reactivity of the pupils. The pupils, if I can remind you, we were told when we're in school that when they're exposed to light, they become small. When they're exposed to the darkness, they become big. So if you find your casualty is not having that reaction in the eyes, then it could be an indication of what we call brain compression, okay, which is a very severe head injury. Now, when we move downwards to the neck, we talk about at the base of the neck, okay? If you find a swelling, a significant swelling, most of the time it is usually indicative of a spinal injury. Okay. Now, if we go to the ears and to the nose, if we find any bleeding and the blood looks watery, it looks like it has been diluted with water, okay, then that is an indicator of a skull fracture. So those are the main things that you're going to see if your casualty is unconscious. Now, if they are conscious, you can be very quick to detect a head injury and a spinal injury. For a head injury, number one, you're going to see confusion. Your casualty looks confused. They're not in a position to make any sensible remarks. Some may complain about a headache, either a mild headache or a very serious headache, what we refer to as a migraine. Okay, and then if you look at their breathing, it's going to be very fast. Okay, and if you take their pulse, it's also going to be very fast. So those are some of the indications of a head injury when your casualty is conscious. If it is a spinal injury we're looking for and your casualty is conscious, they're going to be talking about loss of movement. So you're trying to tell them, please move, or can you stand? And they're saying, I cannot feel my legs. And then how you can confirm that is ask them to wiggle their toes. If your casualty is not able to wiggle their toes, then that one is a definite indication that there's a problem with the spine. And then there's also going to be loss of sensation. So what does this mean? If you pinch them, the casualty cannot feel that you have pinched them. Okay? If you try and tickle their feet at the bottom, they cannot feel the sensation. Yeah, so those are some of the indications of a spinal injury.
How about pain relief? Is there an option for, to give pain relief to these casualties? As much as you're trying to conduct first aid, we can understand that that can be very, very painful. They're in pain. As a first aider, is there something to give them as a pain reliever? Ama hapo tu ni usikie uchungu hadi mwisho?
Hapo sasa ni kusikia uchungu hadi mwisho.
There's nothing that can be done.
There's nothing that can be done. Remember, we say number one, as a first aider, you're not allowed to give any medication. Okay? The only person who can give medication is one who is licensed by the Poisons and Pharmacy Board, isn't it? So you as a first aider, being that you do not have that, please do not give any medication. Do not give painkillers. Okay, if that is to be done, let it be done by the paramedics and the EMTs as well as the doctors. They are licensed to do so. Okay, because there's a problem that you can give them painkillers and then either they affect them negatively, they have an allergic reaction that you had no idea about, or if they're taken to hospital, they are given other medication that will contraindicate with whatever you had given them. So it's just reassuring them, kumwambia avumilie. This is something that we need to do in order to save their life.
So what are the signs that maybe a soft tissue injury is more serious than it looks and needs medical attention, serious medical attention?
Now, signs that a soft tissue injury is more serious than we think is number one, we're going to look at the bruise and the sizing of the bruise, okay? And then number two, we're saying that there are chances that a soft tissue injury could lead to internal bleeding. So internal bleeding, when it is serious, you're going to see it in that your casualty is going to be presenting some signs and symptoms, such as when you look at their casualty, number one, they're looking pale. As if we say they do not have color in their face, and then they are excessively sweating, and when you touch them, they are cold to the touch. Okay, if you look at their breathing, it is very fast, ni kama anahema, and then also their pulse rate is very quick, okay, but also weak at the same time. So when you see some of these signs and symptoms, then now it means that our soft tissue injury has probably led to a what we call internal bleeding, which is now leading to the casualty getting into circulatory shock. But if there's nothing like that, okay, so a soft tissue injury, you can either apply heat, for example, in the cases of a muscle cramp or a muscle pull, or you can apply a cold pack, for example, in the case of strains and sprains. Yes. All
right. So let's say once, you've managed to stop that bleeding, how do you now clean that wound to prevent infections?
Now, with minor bleeding, when you're cleaning the wound, it is as simple as just using water. Okay, I know we have a lot of things that we use on a wound. We want to use Dettol, we want to use Spirit, we want to use all those brand names that we know. Okay, just use water. Okay, water is going to clean the wound, it is going to disinfect the wound, and the wound even heals quicker than when we use the Spirit and the sanitizers. There's a reason why Spirit and sanitizer and Dettol have been written for external use only. Yeah, so when you talk about broken skin, now that becomes internal use. So just use water. Okay, we also have the option of using something like iodine. We know iodine, the brown one.
Yes.
Right? Yes, so you can also use iodine to clean the wound. It is very good. Yes.
Is it always, I've cut you short?
No, it's okay.
Is it always mandatory to get a tetanus shot after, bleeding has been stopped and now you are back to normal?
Most of the time we say look at the cause of the injury. So if it is something that has probably rust on it, then it is very good for you to get your tetanus shot. For example, a nail, a razor blade, iron sheet, mabati. Okay, but also remember, tetanus shots give us a protection of 10 years. So if you know that you've been given a tetanus shot in the last 10 years, then probably there's no need unless now the 10 years have ended. Then now your cover has ended, so you need to go and get another one.
So Brenda, what mistakes do you see people make when performing first aid on soft injury issues?
Okay. Now the soft tissue injuries. Yeah. So remember, I've divided them into two. I've said there are some where we apply heat, there are some where we apply cold. So the one that we apply cold, we are saying it is the sprains and the strains. Okay. For example, someone has an injury on the ankle. They were walking, akateguka. Now what we like to do is tunaitanga kukanda na maji moto. We want to apply heat on a strain or a sprain. That is very wrong. For there, we need to apply cold. Okay. For example, if it is a muscle pull or a muscle cramp, the one that you get, you are running, you get a cramp. You are swimming, you get a cramp. Now, for that one, you need to apply heat. Okay. So those are the most common mistakes that I usually see people make. Where you need to use deep freeze, you use deep heat. Where you need to use deep heat, you use deep freeze. Yes.
All right. Thank you so much, Brenda Murugi, for making time once again. Beg your pardon. Brenda is a trainer with St. John's Ambulance Kenya, talking to us about first aid, how to manage bleeding and soft tissue injuries. Thank you so much for watching. That brings us to the end of the show. My name is Anne Odida. Good morning.